A laryngoscopy is a procedure that's often performed in the office in the awake patient. A patient will come in to see us for complaints of hoarseness or sore throat or voice changes, coughing up blood, something of that nature. And we will anesthetize the patient's nose with a topical spray. It also contains a decongestant. And after that spray is allowed to work for several minutes, we'll pass a small flexible endoscope through the patient's nasal cavity into their throat area and examine the areas that there may be concern. If there are troublesome areas seen, then patients will often be subjected or will be referred for an operating procedure where we put the patient to sleep under general anesthesia. A rigid endoscope will be used, so not a flexible scope through the nose, but rather a rigid scope that goes through the mouth in the sleep patient, and we'll be able to directly view under magnified images the problematic areas. And if we see a suspicious lesion, we're able to take direct biopsies of that. So laryngoscopy essentially can encompass a lot of things. In the office setting, it's a flexible fiber optic camera that's placed through the nasal cavities. And in the operating room setting, it's a direct rigid scope that's placed through the oral cavity. When patients come in with hoarseness or chronic sore throat or other reasons for us to perform a flexible endoscopy in the office, when we see a lesion that is suspicious to us, we'll take them to the operating room for biopsies of those areas. We're specifically looking to rule out cancer. Is there a chance that this patient could have cancer in the throat or neck area? If it is confirmed to be cancer, then we need to find out the extent of the disease, what's involved, other surrounding structures that may also be involved, and form a treatment plan. I would say the vast majority of the time patients come in with those types of symptoms, chronic cough, chronic sore throat, voice changes, it ends up being related to GERD. GERD is a spectrum of disease of acid reflux, and sometimes it has symptomatic complaints such as chest pain or heartburn. Other times it's more of a silent condition, and we'll see it with patients that present with sensation of lump in the throat. We call it globus sensation. So if a patient comes in and they have that globus sensation, they're going to get a flexible endoscope through the nose for us to directly look at the area and examine that specific area of the neck that they feel those symptoms in.